I'm Susie, your high-fidelity adult female mannequin. I am one of 10 high-fidelity simulator mannequins in the Bailing family. I am an extremely complex mannequin, capable of a wide variety of symptoms, ranging from simple situations to extremely complex drug interactions. Today, we will be working together. Please become familiar with my features, and I ask that during your time at our home, that you treat myself and my family members with the same respect that you would have with a real patient. Let's talk about my functionalities. Firstly, I do blink and my eyes are reactive to light. While I do possess ears, they do not have the correct anatomy. However, if doing an examination of my ears is part of your assessment, please go ahead and do so. You will receive information either from the overhead speaker, paper report, phone call report, or an image may be displayed on a monitor. Orally, I have fixed upper and lower dentures, and my tongue may be moved gently from side to side when performing an oral examination. You can intubate me orally and nasally, although you need to lubricate the airway with silicone oil prior to any intubation attempts. Otherwise, intubation will be very difficult and can very likely cause damage. Please do not use lubricating jelly, as it is very difficult to clean from my septum and trachea. When simulating drug administration via an endotracheal tube, please use an empty syringe. I do possess a stomach, which will collect fluid and can be suctioned. However, I ask that you do not put any medications, solid or liquid, in my mouth. It's important to note that my relatives do not have stomachs, so never administer fluids orally, as you may damage their internal mechanics. It is recommended that you use a size 4 Miller blade, or a size 3.5 Mac blade when intubating. A 7 to 7.5 millimeter endotracheal tube fits best when performing the procedure. Please use an 8 millimeter outer diameter nasal tube when intubating nasally. When utilizing an LMA, size 4 works best. Emergency airway access can be obtained through the pre-scored cricothyroid membrane in the event you are unable to secure my airway via oral or nasal intubation. Mouth-to-mouth resuscitation without a barrier device is not recommended, as you may contaminate my airway. Please treat me with the same precautions that would be utilized with a human patient. I possess multiple airway sounds, which will give you an idea of my breathing conditions, which include normal, inspiratory and expiratory stridor, and stridor biphasic. My lungs also can feature a variety of independent sounds in each quadrant, which include normal, wheezing, inspiratory squeaks, crackles, and rails. These lung sounds are synchronized with breathing patterns such as Cosmals, Biotes, Shane-Stokes, apneustic, apnea, and normal. My airway provides nominal landmarks for either providing BVM or intubation exercises, including the use of an LMA. I am equipped with several heart sounds, which are related to the user-defined heart rate and cardiac rhythm. While listening for lung and cardiac sounds, as with all my relatives, you will hear mechanical sounds from an internal pump. Please take the time during this orientation to distinguish the mechanical sounds from my heart and lung sounds. I also possess other features. Normal CPR procedures can be performed, should the need arise. My left index finger is capable of providing a reading from a real pulse oximeter. IV, IM, or sub-Q access can only be performed using needle set size 22 gauge or higher to prolong the life of my veins and skin. There are bilateral sites on my upper arms and thighs for IM injection, where fluids may be administered. Please be gentle. In the event of any emergency situations where I may need to be monitored, shocked, paced, or cardioverted, my chest includes conductive skin sites for use with a real defibrillator or AED, just as you would with a human. The small gold sites are available to connect ECG leads and monitor my cardiac activity. The 2 large gold pads are used to attach defibrillator pads for pacing, cardioversion, or defibrillation. Keep in mind, it is important to take all precautions when utilizing a defibrillator. Our devices do pass real energy, and there's potential for serious injury. If connected correctly, an AED will display my ECG, cardiac rhythm, and advise action. I have several locations where you can palpate for my pulse, including my carotid, brachial, radial, femoral, popliteal, and pedal locations. A manual blood pressure can be acquired from my left arm. You will notice I have open wounds on my left foot. These wounds may be indicative of a diabetic condition, but that doesn't mean every time we meet I will be a diabetic. Please ask me about the wounds if you come across them during your physical exam. If it is necessary to do a vaginal examination, you can very well do so. I am capable of various gynecologic procedures, such as vaginal douching, speculum insertion, pap smear, bimanual pelvic examination, dilation and curettage, also known as D&C exercises, placement and removal of an intrauterine device, or IUD, palpation of normal and 20-week pregnant uteri, and inspection of normal or abnormal cervix is possible. My breasts are palpable. A spiral or grid pattern breast assessment may be performed to detect masses, lumps, or cysts, which include fibrocystic disease, chronic mastitis, a benign tumor with stalk, a giant sarcoma, serous carcinoma, or a retracted nipple. I am a great patient to work with, if you are polite to me, of course. However, I do have a few limitations. I cannot stand or ambulate on my own. I will require assistance if you are expecting me to move. I am not a robot. Remember, while I do possess a stomach, please do not put any medications, solid or liquid, in my mouth. My relatives do not possess stomachs, and we would prefer not to be administered anything orally during an appointment. If you require me to orally administer medication, verbalize the medication, then impersonate the act of medication administration. You will not receive a return from placing a nasal gastric or oral gastric tube. Betadine, pens, and permanent markers are sensitive to my skin and will stain it. Please refrain from using them at all costs with me or any of my relatives. Avoid using plastic and cloth tape with securing anything to my skin. Only use fabric tape to prolong the beauty and life of my skin. I may only appear as a plastic mannequin to you, but I expect the same respect and treatment that you would provide to any one of your own patients. See you soon.